For today's function, we have, I think, since we started immediately after the summit, Kenya embarked on implementing the 17 commitment. First, we developed the report, what we call the Nairobi Summit of the ICPD25. That's what we're going to, our Cabinet Secretary is going to launch this morning. We also developed the action plan for the implementation of the ICPD25 Kenya country commitments. This is an action plan that will run from 2020 to 2030. We also developed and prepared the first annual report on the implementation of the ICPD Kenya country commitment. In this report, what we have is we have the progress report of the first year of implementation. Immediately after the summit, a technical team was constituted under the leadership of the PS planning from the various ministries implementing, for instance, Ministry of Gender, Ministry of ICT, Ministry of Health, Ministry of Labor, Education, and other ministries. And this technical team worked on this document. That one is the action plan for that 10 years. And the other one is that report of the first annual progress report on the implementation of the ICPD25 Kenya country commitment. So those are the documents this morning. Our chief guest, we are going to really share with our citizen and our country, and those are the documents we want to launch this morning.
The commitment made by Kenya at the Nairobi Summit is aimed at enhancing integration of population concerns in development, planning, and implementation in all sectors. An example of this is the Population Health and Environment PHE program that is being implemented by the State Department of Planning through NCPD. This program integrates population and health issues in environment conservation projects, and it has proved to be cost-effective in promoting good health, sustainable livelihood, and environments in the communities where it is being implemented. It also enhances intersectoral collaboration, which is a more cost-effective approach to implementing development activities. The State Department of Planning will therefore support NCPD in advancing the integration of population concerns in all development activities in harmony with the country commitment. Chief guest, the effective implementation of ICPD25 Kenya country commitment will enable the country to achieve other national, regional, and global goals, such as the Kenya Vision 2030, the Africa Union Agenda 2063, the Sustainable and SDGs. Given the important link between ICPD commitment and these goals, I would like to urge the implementers from the different sectors, including civil society organizations, private sector, to work together for the good of the country's population. Chief guest, as I conclude, I note with appreciation that after the Council for Population and Development was mandated by His Excellency the President of the Republic of Kenya to coordinate the implementation of the 17 commitments, the Council has shown enviable leadership to this effect. I wish to challenge the Council to move a step further in building a sustainable momentum of advocacy of the commitment while coordinating and reporting the implementation of the country's commitment. I thank you all, and may God bless you.
It gives me a great pleasure to join you today as we mark 1 year since over 8,300 delegates from more than 173 countries converged here in Nairobi during the summit on ICPD25 to deliberate on ways we can complete the unfinished business of the promise made 25 years ago in Cairo. By the end of the summit, governments and stakeholders made over 1,200 commitments geared towards achieving the 3 transformative results, namely zero preventable maternal death, zero unmet need for family planning, and zero harmful practices including gender-based violence, female genital mutilation, and child marriage. We commend the government of Kenya for hosting the summit together with the government of Denmark and the United Nations Population Fund, UNFPA. We also appreciate the leadership of Kenya, specifically His Excellency President Uhuru Kenyatta, who led by example in committing to accelerate the promise of the ICPD program of action through the 17 Kenya commitments. Throughout the year 2020, we have observed with a lot of appreciation the government of Kenya, the United Nations family, civil society organization, the private sector, faith-based organization, and the public who have all made certain to include the Kenya commitments in day-to-day discourse. Most of these stakeholders have taken a step further to implement these commitments through their programs and their support to government agencies tasked with implementing the commitments. Chief guest, ladies and gentlemen, the UN family under the leadership of UNFPA has worked together with the government of Kenya and other stakeholders to ensure the ICPD25 commitments are implemented as planned. UNFPA supported the NCPD in development of the action plan for the implementation of the ICPD25 commitments, as well as the first annual progress report. To implement the President's commitment to end FGM by 2022, UN collectively through UNFPA provided support in development of the roadmap for Presidential Acceleration Plan to end FGM by 2022, and we are happy that this is being implemented. In collaboration with the Ministry of Health, UNFPA has continued to provide family planning commodities to eliminate the unmet need for family planning, as well as support on provision of maternal health that are key in eliminating preventable death. All these commitments cannot be achieved if our programs are not evidence-based. The UN family is therefore working with relevant government institutions, such as the Kenya National Bureau of Statistics, Civil Registration Services, Ministry of Health, and the NCPD to ensure quality population and health data is available and accessible in a timely manner for decision making. We appreciate the efforts of Kenya National Bureau of Statistics is making to produce the 2019 population and housing census data, and the UN will continue to support this exercise. We also remain ready to support the Kenya Demographic Health Survey of 2021. Chief guest, allow me to appreciate my colleague Dr. Adimola, the representative of UNFPA, for his advocacy and working tirelessly to ensure that all the commitments are well integrated within the UN programming as an approach and are also implemented as planned to deliver on the promise. Chief guest, ladies and gentlemen, as we are aware, the year 2020 was challenging for program implementation and program financing due to the COVID-19 pandemic. And we witnessed organizations including the UN reprogramming finances from the initially planned activities aimed to respond to the pandemic. As a result of measures put in place to curb the spread of COVID-19, there was a documented decline in the update of essential sexual reproductive health, education, and other services. Many people lost their jobs, depriving them of their livelihoods, while elderly persons and other vulnerable populations also suffered increased vulnerability both socially and economically. There was also an increased number of GBV cases reported all over the country. All of this affected the gains that had already been attained in human health and social development, and consequently the ICPD indicators. I wish to commend the government and all stakeholders for standing strong and working for the good of Kenyan citizens despite this aforementioned challenge. In particular, we salute the frontline health workers who tirelessly and selflessly work day and night to ensure women, girls, men, and boys received essential health services. We also appreciate all those who are working to ensure the effect of the pandemic are eliminated and life is normalized. As we forge ahead of the second year of implementation of the ICPD25 commitments, I would like to remind us all that the COVID pandemic is still with us. We must take the lessons learned in the year 2020 and use them to better our interventions. The UN will continue to support the government in implementing the socio-economic response plan and other strategies aimed at helping Kenyans build back better from the pandemic. Chief of Guests, ladies and gentlemen, as I conclude, let me assure you that the government of Kenya of our support and commitment towards working together to implement the ICPD commitments, not only in the second year of implementation, but for the entire period of the decade of action to ensure no one is left behind achieving all the SDGs. Finally, let me remind all people everywhere that together we'll make sure that promises made are promises kept. The march continues. Asanteni sana. Thank you.
We are here to launch the first anniversary of the conference we had some time back a year ago on a very important subject on population, where is a commemoration of the honor that Kenya has been bestowed to host the second conference on the matter. Our coming here today is to launch this report, but also use it as a way of stock taking on the various commitments that Kenya has undertaken. That's why we have officials from various ministries, from labor and social protection, that deals with issues of labor, population movement, the vulnerable groups, the segments of various individuals or targets that have been taken care of. We also had report from the Ministry of Education. We had report from gender, mainly targeting on the issue of the social welfare, but also on the policies that we have undertaken in fighting harmful cultural practices like FGM. We are also happy to note that within the period, that one of the critical ingredients of the national census was effectively carried out, where the report was released in good time for the purpose of using the data, a very informed data for purpose of planning. And we are now here to launch this report. I'll request the UN officials here to join me as we launch this very important report. And one of these reports is on the Nairobi ICPD25 Summit Kenya Country Report. The second one is the action plan for implementation of the Kenya Country Commitment, while the last one is on the 2019-2020 annual report on the implementation of the Kenya Country Commitments that we are launching today. This is the first annual report on the implementation of the ICPD Kenya Country Commitment. Look at the camera, accelerating the promise. That was agenda 10. Thank you. And all the best. Maybe I can quickly. But there is also tea. Please make your.
Speakers.